And kindly allow me to pass it over to the chair for the day, Professor Grace Bantebia, who will be leading us in the session. Over to you, Professor.
Yes, good afternoon, colleagues who are here this afternoon. I just wanted you to see me, and then briefly I will put off the light because I have a challenge with my eyes, so the light is not good for my eyes. I just wanted you to know that I'm around and I'm the one speaking to you. So that I remove my video and then they switch off the light, but I can keep my the mic speaking. Now and then I will put it back. Is that okay? Can you hear me?
Yes, I can hear you.
Yes, that's okay, Professor. Please go ahead. Thank you.
Yes. So, colleagues, you're most welcome this afternoon. Once again to our sort of regular, meetings, learning sessions. And for our week, the week of the working group on unpaid care and the domestic work thematic group. I know we've been meeting and having a number of meetings, but today I want to welcome all of you to this special meeting where we are going to have one of us, and she's the chair, if I'm not mistaken, of this working group, Blandina Bobson, and she's going to give us a very, very important presentation. The issue which is currently on the thoughts of everyone, engaging men. Not only in unpaid care, but it is a subject that has come up with a lot of energy and fire that we need to interact with it and understand the dynamics and the implications for women and girls. But before I go in and to introduce the subject and also our speaker who has kindly accepted to speak to us, I think it's just in order, since we are few, to just have a quick introduction of each other, so that we know who is around. Just we're not very many, just that we get to know each other. So I would request that members, Professor Grace Bantebia from Makerere University, and we are working on a project of unpaid care work, shifting the norms, shifting gender norms so that we can change the pattern of unpaid care work to release women for involvement and engagement in economic activities and labor market. And shortly will be also one of these days, maybe next month or the other month, we have already done an inline survey of the study we've been working on. I'm sure we'll be able to share with this group when the report is ready. So thank you very much. Happy to see all of you. So I think then we can have other members introduce themselves.
I can go ahead and take over. My name is Elaine Chukahert, and I am the Director of Policy and Partnerships for an organization called Kidogo Early Years. Our work is to support women who run child care centers in informal settlements, and most of our work involves capacity building them to meet not just Kenyan regulations in terms of the facilities that they run, but also to be able to be empowered to deliver the kind of quality care that is beneficial to the children that come to those centers. So I'm happy to be here. I also invited my colleague Martin to join as a gentleman who participates in the care economy. Hopefully he'll be able to join, and I look forward to the discussion.
Great. Happy to have you around, and I'm sure we learn a lot from each other today. Who is next? My screen is bundled up, so I don't see the people. I don't see that chat room. Something I don't know where it has gone. But can we have other members introduce themselves quickly? Sarah, if you can help me, sort of call on some of us to introduce ourselves.
Good afternoon.
Yes, go ahead.
My name is
Go ahead, Faith.
Center for Gender and Development. Can you hear me?
Yes.
Okay, I'm saying my name is Faith Nzuki from Collaborative Center for Gender and Development. I'm glad to be joining you this afternoon. Thank you.
Thank you so much. Happy to see you.
Good afternoon, everyone. My name is Eva Muluve. I'm a researcher at the Population Council Kenya office. Thank you.
Good afternoon. My name is Patricia Kitao Ekolo. I work with the African Population and Health Research Center.
Thank you. Is that all?
We have Janet, Judy.
Hello, everyone. I'm Judy Odur. I work with ActionAid Kenya as a project coordinator. Happy to be here today.
Thank you. You're most welcome.
Hi, good afternoon, everyone. My name is Faith Suma. I work with ICRW as a research assistant. Thank you.
Thank you. Nice to have you around.
Hi, everyone. My name is Jack. I work with ChristianAid. Happy to be here. Thanks.
Thank you.
Good afternoon. Oh, sorry. Someone else is talking.
Okay. Good afternoon. I'm Mario Nouma. I work with ICRW as a researcher.
Good afternoon. My name is Diana Warira. I am a policy manager at the Abdul Latif Jamil Poverty Action Lab, or JPAL. Thank you.
Hello, everyone. My name is Janet Kirago. I'm a student at Trinity College studying pharmaceutical manufacturing technology. I'm happy to be part of this.
Thank you.
Hi, everyone. My name is Grace Kathau, and I'm from the Collaborative Center for Gender and Development. I'm working there as a programs officer. Thank you.
Thank you, Jemima. Jemima? Okay, thank you. And I'm Sarah Njenga, working with the International Center for Research on Women. Prof, I think we can now go to the next stage. Thanks.
Oh, sorry, just joined. Elizabeth Obanda here from UN Women, leading our Women Economic Empowerment Unit. Thank you.
Thank you, Elizabeth.
Brilliant. I think that we have a good crowd. I checked on my other gadget and I saw we're just more than even 20, isn't it? That's brilliant. So, colleagues, once again, I'll not take any more time because we are waiting to listen to this important presentation. Today, I would like to introduce our keynote speaker, Blandina Bobson, who is the director of the program for Oxfam in Kenya, heading the Gender Justice and Women Rights Governance and Accountability and Natural Resources programs. She has over 13 years of experience leading the conceptualization, design, resource mobilization, implementation, and monitoring and evaluation of both development and humanitarian programs within the African region. Blandina is a women's rights champion and activist. She's very passionate about amplifying the voices of women through research, thought pieces, and challenging both formal and informal patriarchal systems that propagate gender inequalities and prevent women and girls from enjoying their rights and achieve their full potential in life. Blandina holds a Bachelor of Arts degree in Sustainable Human Development and is pursuing a Master of Arts in International Cooperation and Humanitarian Aid, is a certified monitoring and evaluation practitioner and a Global Public Voices Fellow at Cornell University, focusing on inequalities and social justice. We're very, very happy and privileged to have Blandina to present to us today with a topic that really is, as I said, is very topical. And as women activists and feminists, we really have to really open up, really be very careful, and also really understand this phenomena of engaging men, which is very critical, and see how we work with it. Today, we are going to hear the work that has been done through Oxfam, and that is engaging men in unpaid care work. You remember, this is our thematic area. Engaging men in unpaid care work, strategies for influencing change of gender norms. So this is very, very core, because it is we're going to hear about these gender deep-rooted norms, which many times favor men, and the strategies of engaging men and ensuring that we can change them for our key purpose of empowering and ensuring that women and girls enjoy their rights as equal citizens of this planet. So I don't want to waste any more time. I want to welcome you, Blandina. We are super excited, and all ears and eyes are on you. This is a very good topic, and you can see many of us are going to join. Thank you and welcome. The floor is yours now. Thank you.
Thank you so much for that detailed introduction. I was laughing because of like, we have always met when Sarah reached out and is like, we need your bio. I'm like, come on. We're always engaging, but I really appreciate it. And I'm really happy to share what Oxfam has been doing as far as male engagement is concerned. It's one of the strategies that we're using to deliver on our work on the recognition of unpaid care and domestic work. Not perfect, but still work in progress. And we've seen some changes from our engagement. So I'll just do our PowerPoint presentation. I think if we have some time left, I can just play something, but I think the presentation would be more important, and I'm happy to take questions as well. Let me know if you can see my slide.
Yes, we can see a slide, and I think we're going to give you about like 25 minutes so that members can also ask you as many questions as possible. And some of the work you can share with us.
Okay.
Yeah.
So I guess when we were preparing this presentation, I think the question that came to mind is that even as a country, this has been the main conversation. This has been, the one thing that everyone is engaged in right now. The question we ask is that, are we ready to see, men in public undertaking unpaid care and domestic work? And I say this because some of the experiences we've had, even though we've had some successes, is that the men who are willing to change and, support their spouses or their families in undertaking unpaid care and domestic work, but they're only willing to do it behind closed doors. They don't want to be seen because of the, backlash that they will receive from the society. So I think as we are, engaging in this sector, we need to approach it in both ways. Look at how we transform, the men to be able to support with this, but look at it also from the perspective of transforming the whole society and how they perceive men who are willing to change their ways and, support their spouses, or, and to undertake unpaid care and domestic work, because that's also one of the barriers towards why we don't have as many men as possible wanting to, move towards this direction. So we all have our story. We come from different communities, different ethnic backgrounds, and I think in every community, the one thing that unifies us is that story where we all identify with, where men are not supposed to be seen in the kitchen, men are not supposed to be seen doing what is considered for the women. That men who do this are considered less masculine. Their role is only to provide, security and provide for their families, but not necessarily to support in this kind of work. So the question is our social norms a reinforcement or relaxation of these behaviors? There's the question of if as a man, I do unpaid care and domestic work, what will the woman be doing? Because we also see, we don't see the benefit of rest. We assume that a woman who is, just seen resting is literally not a good wife. And this is basically, there's evidence towards that. Women are supposed to be industrious and to be seen to be running around in the house, that even resting is seen as an indicator of not being a good woman. So the questions that some of the men have asked is, if I do this unpaid care and domestic work, what will she do? What is the other work that she'll be doing? Yet this is the work that is designated for her. We also have stories of men who have said they don't want to do it because of the, reception that they will get from their wives. It brings conflict in families where a man, has transformed, is willing to change, is willing to support. But we have women, which is very sad, who still uphold these, retrogressive perceptions and think that this is a work that should only be done by women. So women themselves are becoming a barrier towards this transformation that we are seeking to change. So those are the questions I guess we are grappling with, even as we engage with the communities, even as we engage in different spaces, that we have women who are a barrier, and we are also dealing with men who are not willing to transform. But we have men that are willing to transform, but are more scared of how society perceives them if they change and do this work that is supposedly meant to be done by women. And why this is important, of course, we know very well the care economy is, is for the good of the society, the well-being of the society. It's the glue that holds, our economies together. And I always say, in those instances where women wake up one day and decide they're not doing care work, like everything will come to a standstill. And I really dream of a day that happens where, we just put everything to a standstill because women have refused to do care work. Maybe that's the day that people will recognize the importance of this. We know women are, the ones that are mostly engaged in unpaid care and domestic work. 5% of the work is done by women. 42% of the women worldwide are unable to engage in other, activities, including economically productive activities, because of the care-related, engagements that they have or are expected to undertake. But we also, as we seek to challenge this, we need to do it in a democratic and healthy way to enable everyone to move at the same pace. I think even for Oxfam, in the previous years, we've only been focusing on women, and then we realize you empower women, you give them this information and tell them, this is what is supposed to happen. These are the priorities that you should probably take to your ward administrators, because they reduce the time you spend on unpaid care and domestic work, and forget that they're going back to homes that are governed by men and might not even have permission to go to those public participation spaces, or might not be able to convince their men to do anything. So it's important that everyone is involved, both men, women, girls, and boys, and it's especially for the children, it needs to start at a very early stage so that it's easier to change their mindsets rather than what we're grappling with, trying to change the mindsets of adult men who for the whole of their lives have never seen men, engage in care work. And then we also need to take into consideration that social and gender roles may differ from each other on society, at ethnic level, or at cultural level. So male participation, and so is male participation in unpaid care and domestic work. And so this current conversation, the current wave that is going on right now, and the recognition of the care economy is a wave that we need to take advantage of, basically to influence, the transformation that we are seeking to achieve. So why male engagement? I think some of these things I have alluded, but I did mention that one of the biggest barrier towards the achievement of, achieving the recognition of unpaid care and domestic work is the regressive narratives and perceptions that we uphold. And this is at all levels, not just at the household level, but even in different spaces. If you have engaged even on policy conversations, I think the question is, why are we discussing washing utensils in the boardroom? Like, why is that important? It's sad also when you engage with even female, policy makers. And an example I had the other day, I was engaging with some senators on the national care policy, and I was really trying to explain how beneficial it is, to everyone. And a female senator asked me, so after this policy has been instituted, how will women benefit? What will the women get in return? And I was short of words, because I thought as a woman, she probably would be the one person that would understand. But this is a woman who is totally clueless, even though she's one person that is probably burdened by care work, but she can't even see the benefit of this, care policy. So the biggest barrier has been, just the perceptions that we uphold towards unpaid care and domestic work. And then we need to take up this strategy, because men are part of the solution. We live in patriarchal societies. They definitely, call the shots in different spaces that we are in. And if at all we are to break even, or you get to a point where care work is recognized as valued work, then we need to bring them on board so that we all move at the same pace. And then there's evidence that, even at household level, where people support each other in terms of undertaking care work, that the relationships are better, the well-being of the family has improved. And this is one of the narratives that we are trying to push, so that the men don't just look at it from the perspective of I'm helping a woman, but also to realize it has a benefit for the whole family. It also contributes, significantly to the reduction of gender-based violence. We've had instances with some of the communities we are working with where, a woman has been battered just because she came home late and, failed to maybe prepare food in time and all that. So it is linked to gender-based violence. And if at all this can be addressed, then we'll see a significant reduction in, gender-based violence. Of course, there's a rich history of men as change agents in, socioeconomic and political developments, and we need to leverage on this to also utilize this strategy within the care sector. It has worked in other sectors, and it should also work in this sector. You just need to have a few male champions who really believe in the cause, and you'll start to see transformation. If they lead by example, we'll have a couple of other men following also on the same. And of course, gender transformation is for a social common good. This is not just for the women, but if we do achieve this transformation, we know the whole society will benefit and our economies will benefit as well. And definitely, it's one of the strategies towards achieving gender equality. So the objectives of our approaches and why we apply this as Oxfam, first of all, is to be able to achieve change at household level. We know, of course, all societies are built, by families. It starts at the household level before you even get to the global level where we are talking about government and, and nations. It all starts at the family. The behaviors, the practices, the perceptions that, individuals who live in a household, uphold have a bigger impact on the, have an impact on the bigger picture that we are trying to achieve. So it needs to start at the minute level to try and start changing those or transforming those behaviors. And then slowly, steadily, we'll see this, kind of scale up to the whole community. And before we know it, we have a change at the national level. We also are doing it to shift narratives, again, because this is one of the barriers we have, biggest barriers we have noted, but also because we there's there's a power in just the different things that people say. One of the studies we are launching tomorrow is on shifting narrative. It was done in Kenya, Uganda, Kenya, Zimbabwe, and the UK. And one of the things that came up was, just the language, that we're using to refer to care work. Some of the respondents that were interviewed would say, household work is kazi chafu, is kazi ya maid, and all those things. So for as long as we're using these phrases, it will not change. And, our children come and pick up this type of language and they grow up with it. So we need to start changing with how we even communicate about unpaid care and domestic work, how we, the narratives that coexist right now, try to counter those narratives if at all we are going to see any change at policy level or at institutional level. And then the other objective is around strengthening institutions, because again, we leave our homes to come to different institutions, and they do have a like care-friendly policies within those institutions. Unfortunately, it doesn't exist, and it's become a challenge. Every time a woman thinks of having a family, you're torn between, losing your job and keeping your job. So we have people who have made choices not to have children, not because they don't want, but because they know the minute they do that, they lose their jobs. And we have women who, are career focused, who have had to quit their work to focus on family because we don't have an enabling environment for them to be able to do both. I believe it should be a choice that if I decide to have children, I'm doing it because I love children, not because the other circumstances that are forcing me to just quit and go and be a stay-at-home mom. And lastly, we're also doing it, the male strategy to influence policies. We believe, all the policymakers, the majority of them are men. When we're talking about these national care policies and the other policies we are pursuing, when we present it, it was going to be presented to men. So if they still uphold the same perspective, these policies will not see the day of light. So we need, it's important we do this. So how we've done it in Oxfam, one of the approaches at the household level has been through couples sessions. So we would mobilize, different couples and have conversations. So with the women separately, just to try and get where they are at as far as seeing their men perform care work. And then the men separately also to try and understand how they feel about this and, educate them on the importance of it. Once we're in a place where we feel like they're on the same level and they're in agreement, then we bring them together and we have sessions for all of them. And we've seen, great improvement in terms of, these men supporting their women to do care work, taking care of children, supporting with household chores. But also some of them have said they do it, but they're happy to do it behind closed doors. They don't want to do it publicly. The challenge is that, especially for the communities we are targeting in the informal settlements, you don't have like a 3-bedroomed house which has a bathroom inside or everything inside. You still have to step out and hang clothes or wash clothes. So that has been the challenge. They're willing to do it, but the environment is not enabling because they're not ready yet to be seen by the public to be doing this. So that's this is one approach that has worked. The few who are doing it, behind closed doors, and we have a couple of others who are confident enough to do it publicly, and they attribute, the happiness of their families to their contribution as far as unpaid care and domestic work is concerned. And then we use, we've infiltrated media spaces and specifically targeting male influencers because yes, we can target female influencers, but it comes off as natural that a woman should do unpaid care and domestic work. So we thought, why not work with male influencers because they reach a certain demographic, but they are also men, and they'd be able to pass this message that it's okay. So we've worked with Njugush, we've worked with also Ted Josiah specifically because he's a single dad, and he hasn't shied away from, talking about how he takes care of his daughter. And every time we've engaged him and he shared or like videos on social media or, he's in media spaces engaging, you can read from the comments like, people asking, why can't you just get a wife? Why can't you just marry and have the wife take care of the child? So that tells you how we perceive parents who opt to take care of their children. And, you know, the first instinct is, why can they just get married and let a woman take care of this child? Why do they have to do it? We also are training male journalists. I mean, we've trained female, and we have a couple who can report on care-related issues, but we think also training male journalists sends a very strong message to see men break down this information, because unfortunately, sometimes when we have some of these engagements, you just don't know who will be sent to come and report. And when you have male journalists reporting about this, they report it from their male perspective and not necessarily why it is important for people to all engage in unpaid care and domestic work. And then lastly, also just using activism as a pathway to change, where we've engaged musicians, mostly in the informal settlements. We've worked with Mukuru youth, who we would give a topic and ask them to compose a song related to, you know, any of the areas we are working in, including care work. And then just it's either played, they have the Mukuru festivals that is done annually, or we'd also have it, you know, play on YouTube. The only thing is that we would love to see this go beyond, because they reach a certain demographic, but there's the middle class, you know, and there's the rich people. What kind of art would they be interested that can be used to disseminate this information? We've thought of rugby. We still don't have an angle yet, but we think rugby can be a good space to infiltrate, and also the Matatu festivals. We've in community and policy making spaces, so we've used border riders, and we all know like how powerful these are. When they come in groups, or when you have an accident and you see them, you know, supporting each other, it kind of tells you the kind of power they have. But they also are some of the people that have the potential to do really transformational things in the country if engaged in the right way. So we've engaged them in some of the informal settlements to mobilize and organize, especially during public participation processes, and support the women to present their priorities to the ward administrators. So aspects related to health, education, water, they've really mobilized and, you know, made sure that they're present to ensure some of these agendas pass, but also just in terms of disseminating information, because we believe if we can use them, they're in contact with a lot of people. You just need to have a few champions and you have like the right message being disseminated. We have youth champions. We've partnered with VSO, and in the informal settlements as well, they've been used to present certain memos to the ward administrators, which has been integrated in the annual development plans and the county integrated plans. And then we have legislators and politicians. So we've identified a few within the different wards and sub-counties we are working in. And the idea is once we have the community tabling their priorities at that level, then you have these male legislators who will take this forward, because it will still come to them. And if they don't see the importance of implementing this, then it becomes impossible. We don't achieve our goals. So we are taking a layered approach, ensuring that we have these male representatives at all levels, and we are able to achieve what we want to achieve. So we have a couple that we are working in that we also consider as male champions within the legislators. And then we have religious spaces, and this is because of the power that, you know, these religious leaders hold. And then, you know, they inform how people behave. They inform the behaviors of their followers. What they say goes most of the time. We've had instances of, you know, targeted community members who have gone to report on gender-based violence cases and they're sent home and they're told, you know, as a woman, it's your work to do this and that. But what if we shift how they perceive this? What if we shift the message that they disseminate in their pulpits? And, you know, because once they do this, then you have the followers literally practicing what they're being told. So we have champions as well in the informal settlements who are religious leaders, whom we are trying to build their capacity and trying to see how we can use these the platforms they're in to basically change the mindsets of how men perceive unpaid care and domestic work and who should be involved in doing it. And then we have also within institutional spaces, because there's need for, like, you know, aspects of maternity policies, breastfeeding areas, paternity leave, and all those. which in some institutions it doesn't exist. And so what we have done, one of the things at Oxfam level is that we identify even staff within the institution, male staff, that can be champions. And we realize even when we are targeting people externally, our own staff internally or men would not really understand what we are talking about. So every time we have public campaigns, we would actually ask, our male colleagues, can you send photos of yourself, supporting your wives? Can you take part, in a certain exercise that shows you as a man doing unpaid care in domestic work. So slowly, steadily, you would hear in meetings, someone saying, I'm sorry, today I'm not able to put my camera on because I'm doing unpaid care in domestic work. So it's become like a tag. They're really proud about it, but I feel like it's also the first step towards ensuring that this change trickles outside of the organization, but we also don't have barriers internally when we're trying to push certain agendas. At some point, I remember one year I requested that during Mother's Day, can we have a day off, as Oxfam, so that people can go home, husbands can support their wives, those who don't have wives can go and support their mothers, just a day off, just in recognition that care work is actually valued work. And we in this day, we kind of give a rest to the women in our lives and try to support them in this. And that point we had like the person I was engaging who was supposed to make this decision was a man, and he said, but it's not important. Why would we take a day off just for people to go and do this? And for me, I felt like it was a very strong message. You send out a message that we recognize this as work, and as an institution we are doing something towards it. We also, at institutional places, is also trying to change, practice, how people perceive this. So we've worked we have projects that are targeting small and medium enterprises. And even though the designs of the project were basically towards providing business development services, now we're working with them to integrate care work in what they do. And we're not doing it just with the executive directors or, the people who run the companies, but we're identifying male champions within those private sector institutions. We are also doing the same within the agricultural sector, specifically the tea and the flower farms. And yeah, so the last slide, basically, I think some of the recommendations that we have gathered is that these intergenerational dialogues need to continue. How my mom perceives care work is very different from how my children perceive it. And that generational gap is also a barrier. My mom would probably not want, if I had a boy child, would not want to see this boy child do unpaid care in domestic work. So how do we bridge the gap? We need to find a way of not just having coupled sessions, but bringing different generations together and, having that dialogue and them understanding where each one of them is coming from and being supportive when this happens. We need to continue advocating on the intersectionality of unpaid care and domestic work, on gender equality. And it will be interesting to see a study that quantifies the economic value of unpaid care and domestic work by both sexes. We know it does contribute, to the GDP. We know the percentages, but what if everyone else was involved? How would this add to our economies? And of course, we need to fast track the implementation of the existing legal frameworks that speak to the care development. I think there are some that we can still leverage on, like the Employment Act, which clearly stipulates how employers should be treated, the privileges or the benefits that they have. I don't think we have fully exhausted on the areas that need to be strengthened. So we can still leverage on that to try and push some of care-related issues, even though they don't come out, they're not just pronounced in those policies, but we can leverage on them to try and push some of these agendas, even as we wait for the national care policy. And then also leveraging on existing social formation to reach men. So men fellowships, the couple sessions, and also sports are among other spaces that we can try to infiltrate. And then, of course, identifying positive masculine men as champions in driving the advocacy messages. So that's it. I'll stop here and just listen if there are any questions.
Wow, wow, wow. That is brilliant. If it, I think people can send you flowers from somewhere or even club, because this has been a great presentation and there's a lot to learn. And I know we don't have much time, so can we, immediately go into, I would have a million questions, but I'm going to reserve them. But now can I give the audience to ask some few questions, because the presentation has been very comprehensive and the whole issue of, combined the intersectionality and the issue of the multiple interventions at different levels is very key in targeting different groups and institutions and structures, which tells us and which we know that unpaid care is grounded in the foundations of the families and systems. And we have to go that way also to understand, but also to introduce change and shift. So can I see the hands or the names? I had to move to a smaller screen on the phone because the other one collapsed during the way. So Patricia, please go ahead. I see your hand. And don't ask many questions because I can see there are going to be very many hands.
Thank you. I'll just ask one question. Thank you, Blandina, for your presentation. My comment is on something you said at the beginning of the presentation, where women may be gatekeepers for the entry to gatekeepers against the entry of men into the unpaid care work sphere. And you mentioned that somebody asked, what's the importance of the unpaid care policy? How will it help us? Maybe you could speak to that and just reflect on how such a situation could be dealt with, especially when we think about implementation of some of these policies. Development is easy, but how about implementations? What are some of the things that we may need to think about as we think about implementation of such a policy? Thanks.
Thank you so much. We shall allow Blandina to just take note of them, and then we take a number of questions, and then we'll give you space to and time to respond to some. If not, if you are not able to do that, I think we are on this list. Some of them may be answered if we run out of time. So can I see another hand that would like to ask a question? Is there anyone who'd like to ask a question?
Yes, Grace, my hand is raised up. Sorry, my name is Jack.
Okay. Go ahead, Jack.
All right, thanks. Thank you. First of all, thank you so much, Blandina. This was really incisive and also comprehensive. I just want to build on what Patricia said. How do we tell our advocacy rather than present it as a problem? I think the framing of our messages going forward should be around what are these benefits that we stand to gain, or package it in a way that demonstrates what are we losing should we maintain the status quo. So so in your answering of the question, and also in all these actors who are on this call going forward, it's all about the packaging of our advocacy messages around the unpaid care work to really demonstrate what the country or what our society stands to gain when we address the unpaid care work, when really we redistribute this. Yeah, rather than present it as a problem per se. Thanks. Over.
Thank you. That is question number 2. Can we have another question, please? I don't see the hands, but you just have to tell me that your hand is up. Sorry, I'm a bad moderator. I have a bad machine here now. Is there another hand?
Hi, Elizabeth. There's Elizabeth here.
Oh, please, Elizabeth, go ahead.
Yeah. Sorry, first of all, my network keeps, waxing and waning, but I hope that you'll hear me before it disappears. Thank you for
It is really jumping.
I
Eh?
think my
Can you type it
my,
in the
yes, I know. Can you hear me now? Can you hear me
No.
now?
Okay, now we can hear you.
Hear me now?
Yes.
Oh, okay, I'm sorry. For the presentation, it was like insightful what the finding that men are saying, yes, I'm willing to be or not public. So
No, we are not able to get your question.
we have been supporting the government of Kenya to the policy. I'll try and see if I can come back. Let's go with somebody else. Thanks.
Maybe type it also in the chat. So can we have someone else as she's typing it in the chat?
Yes, this is Diana from JPAL. Thanks so much, Blandina, for that presentation. Very interesting and great insights there. My question is regarding how to change those attitudes and norms, social norms around unpaid care and domestic work in the other different socioeconomic classes. And you did touch on that the Oxfam team is thinking about the pathways of how you can reach these other groups. And thinking perhaps knowing more from the research perspective would be helpful to have very evidence driven or evidence informed pathways so that you're able to tell whether what's the correlation between socioeconomic status and the attitudes towards unpaid care and domestic work, and what are those mechanisms that would be highly effective in shifting the direction of being in support of unpaid care and domestic work. Thanks.
Right. Do we have another hand? I think I saw there was someone else who had the hand up.
Yeah, mine is not really a question, but probably a suggestion moving forward with this conversation, because we are talking, even as we are talking about institutions, I'm just wondering, what about in schools? What about the curriculum? Because you will see in books, like women, even with the pictures, women have been drawn as doing certain kind of chores, and men, they have been portrayed as to, doing this kind of whatevers. So even moving forward, what can be done in terms of, at the school level where these children spend most of their time? Yeah, so that they grow up with informed. Yeah, thank you.
That is really very, very cool. It's very important. Any other person? Okay, we can have Blandina.
Hello, sorry, I have a question.
Yeah, please go ahead. And your name, please?
A comment. My name is Janet. I had a question, Blandina. Oh, excellent presentation, by the excellent work. I love it. On the limitations concerning the unpaid care work for the men. Mainly, I had the question concerning the limitation when the woman will bathe both the girl and the boy baby, and no one will care. But in terms of even social norms, or I don't know, mentality, if the man bathes a male baby or changes the diaper of a female baby, like would that is that a limitation towards the reach of men in terms of what they can do at the home? For example, because I was just wondering, I've never seen a man changing a diaper like on a diaper poster or something like that. So just what the previous lady was asking, like we don't see the images whereby the men are doing unpaid care work. So I was just wondering, what are the limitations? Yeah.
Thanks. So maybe I can start with you and just go from the most recent question to the first one. So it's interesting, and it's a perception issue, and I think it's mostly also propagated by women. I do know someone who is a single dad. This person lost the wife and of course decided to take care of the child, and the mother-in-law traveled all the way from the village to come and ask him how is he bathing his girl child. So what he did, he took a big basin, poured hot water on it, warm water, and dressed the child and put the child in the basin and bathed the child and told the mother-in-law, this is how I do it. But of course that's not what she meant as the mother-in-law. It's like, how does a man bathe a child that is a girl? And most of the times I think the counter has been when a man is seen doing that is that there's gender-based violence. You encourage men can't be trusted around women or girl child, and that as women we're exposing our children to risks. But I think the question for me is that the same way that men feel? Because I don't think all men are perpetrators. And I don't think, if you're a father and you're a loving father for that matter to your child, that you would get those kinds of thoughts when just because the private parts of your child are exposed to you, then you start having, certain thoughts. And I think those are the narratives that we need to counter. And the only way it can be done that is if we have a few men who are willing to get the backlash, but are willing to do it even as they get the backlash, because then at some point people move on and people start saying that it's actually not such a bad idea. It's actually not exposing our children to risk. It's just that this is a parent, and a parent is supposed to take care of their child. So if your wife is dead, is not there, or is sick, does it mean this child will not be birthed just because it's the man that is in the house? So I think we need to find very strong counter narratives for some of these perceptions or narratives that have been doing rounds, especially on social media, which are mostly propagated by women. And then there was a question around why we haven't thought about doing this in schools. I did mention at the beginning that we have this shifting narrative study that we're launching the synthesis paper tomorrow. And this specific one has narratives counter narratives. So what we did is that tried to understand the existing narratives on how people perceive unpaid care and domestic work. And then we developed counter narratives with a couple of colleagues. Some of them are here, like Diana, develop these counter narratives, which basically it's like frames. So we have one that is a nudge frame. It nudges a man to do unpaid care and domestic work, and it tells this person the benefit of doing this. And then we have loss frames or loss narratives, which are basically geared towards telling the man on what they stand to lose if they don't support, their spouses or their families in undertaking unpaid care and domestic work. And then we have a gain frame. This is talking about if as a man you support in undertaking unpaid care and domestic work, these are the gains that you will have. And I know this, Jack, also answers your question. So the plan is to now use those narratives in public campaigns. So consistent, public campaigns, use the same narratives over and over until they stick to people's heads. But we're also thinking we can take it to the schools, and in Kenya specifically, leveraging on the competence-based curriculum, which allows for that kind of practicality. I think there's a way that we can actually, maybe pilot in a few schools, use that curriculum to ensure that we're disseminating those messages and see how then this would be effective in the long run. When these children grow up, do they have a different, perspective from, what the other children uphold? So it's still something that is in play. We don't have the resources for it yet, but it's something that we have thought about. Diana, a question on how do we change these attitudes, especially of the demographics that we haven't been able to reach, like the middle class and all that. One of the projects we are implementing right now is trying to develop a community of practice for the employers of domestic workers living, the ones in the middle class. And what we want to do with them is, first of all, share some of these evidence pieces that we have, the findings and the recommendations, just to also start changing their mindsets on how they perceive unpaid care and domestic work. And we're hoping if we have a solid community of practice, this is one that can actually be used to reach out to the larger group, because they're fairly inaccessible. Even mobilizing them is just so difficult. They're never available. They're busy looking for money. But we feel like one of the vehicles we can use is having a community of practice of, employers of domestic workers within the middle class. But I also agree to your point around just gathering evidence, and is trying to see how, you know, the economic aspect, how it impacts, you know, how people perceive unpaid care in domestic work. I mean, people in the informal economy, do they have the same perceptions as people who are in the middle income class? And if they're different, what are the strategies that we can actually use to engage the middle class and the rich people? And then there was a question around, of course, Jack, I answered your question on how to counter the existing narratives. So, of course, we have a sample frame narratives that can be shared with everyone to use, that were tested and they seem to work. The question on women as gatekeepers. One thing that I know that has come out very strongly, especially from the government, I think we had a meeting with the then PS, State Department for Gender, and her request was, we need to have a national level, you know, stakeholder engagement where we educate them, bring them to a level, you know, school them like 2-year-olds on, you know, the impact of unpaid care and domestic work to the economy. So both negatively and positively, and in the lives of women and men. Once we're on the same level, when we present these policies, chances are they will pass. Another very senior person within the State Department for Gender said, if we don't do that, this national care policy will be dead on arrival, because the people we are trying to engage, the people we are trying to push to approve these policies are not on the same page as us. So I think to answer that question on how we deal with these gatekeepers, I would say we need to sensitize them. Let's not take it for granted that everyone has the same understanding as us on how important unpaid care and domestic work is. And then and this has to be done at all levels, because of the devolution, we have, you know, gender officers at the county level. We have people who ideally should be the ones who would be implementing these policies. And if they're not sensitized, it would just be another beautiful policy sitting in a shelf somewhere and not really being implemented. So we need to see how we, you know, sensitize all levels of government officials, if at all we want to see this policy implemented. A very simple tool we have used is usually the rapid care analysis, that just you basically assess yourself as an individual on the amount of time you spend or what you do, like within a 24-hour window. And what I've seen, we've used it in Kiambu County, I think, with the government officials, and it's like an awakening, you know, once they realize that my wife spends like 10 hours every day on care work and I'm just seated there waiting, they literally live out of that room saying, I'm going to be able to do something, I'm going to try and change even at the household level. So that's a simple tool that can be brought even into a boardroom with these very big people and try to get them to that space, that personalized understanding of how this is impact their very own lives and those of their loved ones. So I'll stop there. I know it's 1 minute past 3. I don't know if Elizabeth typed her question.
Yeah, we started a little bit. If there is any other burning question, really can come up. I have one burn as people are thinking of other questions. Is I'm really, I don't know if you have come across this gatekeeper business, but also the other issue that has come up in our study is that unpaid care being one area that defines who the proper women are. And that seems to be so core that some we've in our sample we have even divorce cases where, you know, the changes are sort of happening or are seemingly should be happening. So what did you see in your sample? There are not many divorces, but you can see some cases where the women, you know, vehemently disagreed on the men taking over their role, and they ask now, they are going to think I'm not a proper woman. And so that identity issue is something we need to navigate and see, because, you know, they said, you know, Grace, for you can be called a professor, but now for me, what will they call me? They're just going to say Mama Joyce cooks so well and she takes care of the husband. So have you encountered that kind of narrative?
Yeah. So it actually came out as I mean, it was one of the findings of this study, because one of the questions we were asking is, who do you consider a good woman, or who do you consider a good man or wife or husband? And of course, I think it starts from there, even before you get married. And this is a very popular thing in Kenya, where, if someone is seen to be laboring, you're in the village, you're carrying firewood, you're cooking, and you're doing all these, people say, that's wife material. And that's where it starts, that men are accustomed to think that a woman who labors and does all these chores is the person that they should marry, and those who are not able to do that are not considered wives or good women. So we saw that, and the same sentiments came out also from some of the respondents, where they were saying, but what would people think of me if they see my husband doing this? This is supposed to be my work. As a wife, as a good wife, this is what is expected of me. The same for the men, where they say the role is only on, providing, for the family, and the wife is supposed to do this because as a good husband, this is what they're supposed to do. And it does, like I did mention, we've seen it contribute a lot to gender-based violence cases, which I guess some of them culminate to divorce, because you're not seen as a good wife, or you're not seen as a good husband. And unfortunately, people get into marriages thinking that they need to be slaves, toil for their families, for them to be seen as good wives. You go to the village, during the holidays, and you're left to do the cooking for everyone, and you're a good wife. Of course, you get the accolades, but what does this mean for your health or as an individual? Yeah, so it is also a common narrative in the country.
Yeah, thank you so much. I would really love you if you could share with us those publications you are launching tomorrow with me. That would be really great. We could just make some comparisons. Thank you. Is there any other question or any comment?
There's a question from Janet who says, I'm curious to learn, have you done a study on the acceptance of people on male nannies or domestic workers and the willingness of the boy child to do this domestic work to provide for their families? So we haven't done this, but I think in this specific study, one of the questions we were asking is around who people identify with as a domestic worker, and everyone thought paid domestic workers should be done by women. Not anyone, not at any point did they even perceive seeing a man as a domestic worker. And in a different space, I think I kept asking, it was like someone who has an agency for domestic workers. I asked, would you consider bringing on board male domestic workers into your pool? And they said no, because these are not acceptable within families. People start to think, okay, male domestic workers, girl child, you're exposing your children to risk, so they're not acceptable within the society. But I think it would be an interesting study to do.
Yeah, I think it would be very interesting. Yeah, that's for sure. Hi, colleagues. I think we could go on and on unless there is a burning question. And I think really you've done a great job, the sharing, the different perspectives. And what your study tells us there's quite a lot of work that is going on, but there's also quite a lot of things we need to do, and targeting different institutions, different stakeholders, because unpaid care is so foundational to our ways of living that it is internalized and people can't think of questioning it. And it also has power and so on. So that becomes very, very problematic. But I'm glad we are beginning to unweave this puzzle, and your study does that exactly. And we are very happy that you shared with us this study today. And personally, I would really like to have the publications you are launching and the other material that can help all of us. As I said, I will share our study, because for us, we took a different approach altogether in addressing unpaid care at household level. So we'll definitely share notes. We did something very different, and we'll share more. I think I've ever presented here, but I think now we're getting the findings. It will be the right time to come back and share with the group. So Sarah, Blandina, do you want to say something?
Yeah, before Sarah comes in, I think Josephine has asked the ongoing revision of the 2018 systems of national accounts and the fact that unpaid care is one of the issues under consideration, what is the entry point for advocacy team? So one of the entry points that we have identified is to try to influence the National Treasury to also consider alternatives metrics to the GDP, because I think everyone looks at the contribution of unpaid care and domestic work to the GDP, but we have other countries that have different metrics for measuring this. So, and then it's considered a more feminist way of measuring and not necessarily just looking at the monetary value. So there is there an opportunity to see if Kenya would be one of those countries who would move away from, money as a measure of, looking at the GDP as a metrics for unpaid care and domestic work, and consider maybe different metrics. So there is an opportunity, but I'm happy to share. There's a study that we did as well. I'm happy to share that with Sarah, and then it can be circulated, and maybe at some point we can have a conversation around that.
Oh, that'd be brilliant. That'd be brilliant, because that's really very key, and it will make a lot of difference. Sarah, I want to hand over back the chair to you, and I say, thank you so much, and I've really enjoyed this. I wish it could go on up to 6. I thought I would be dozing with my eye, but now I'm still wide awake. So, which means I've really enjoyed, and the participants were pretty active. By the way, this is one of the sessions which is fully attended by all the members and non-members, and it shows the importance of this subject matter. Colleagues, have a beautiful evening, and thank you so much for this gathering this afternoon. It has been worthwhile. Thank you. Sarah, back to you in case you have any logistical matters.
Thank you. Thank you so much, Professor Bantebia. Thanks so much for the great moderation. You did it so perfectly. And many thanks to you, Blandina, for such a great presentation, for sharing, the findings and the learnings from Oxfam. I'm sure we've all benefited from that knowledge. And I think it speaks strongly to our current time as a country, even as we seek to finalize the national care policy, and speaks to the, great work that we need to do in terms of socializing that policy, in terms of preparing the ground, so that by the time we are, finalizing, then the ground is already fertile to receive and to go into the implementation. Thank you so much, the members of the thematic working group. Oh, thanks so much for being here, for listening actively, for asking the great questions and providing feedback, and contextualizing the findings to what we are also seeing from our programs and from the research that we are doing. We've recorded the session. We will be sharing it widely with you and the others who sent their apologies, who are unable to attend, and also to the entire WCOP membership. So we are having another learning session tomorrow. We will be waiting to see you in that session as well. And Blandina, importantly, has another session that's running tomorrow in the morning hours. We hope that you'll also be able to attend and to continue the learnings and to, pick on the key results from the other piece of work that they've done. So we thank you so much for making it today, and we look forward to engaging on email and to seeing you more in the other sessions. Thanks so much, everyone.
Thank you. Bye.
Bye.
Thank you. Bye.